Well, let's stick with the issue of health. And I'm just going to show our viewers this BBC story, which is about NHS reorganisation. It says here, NHS, government plans to reverse Cameron-era reforms. This is David Cameron and talking about the reorganisation of the health service in something called the 2012 Health and Social Care Act. It was about a reorganisation of NHS planning and commissioning. We're just going to play you part of an interview I did with the then Health Minister in 2012 from the Daily Politics. Let's have a look.
What will be different is there will not be the day-to-day political micromanagement from Whitehall of the NHS. What we will see is doctors taking control of commissioning care for their patients. We will see cutting back on bureaucracy, partly through the bill, but also through the QUIP programme, so that the money that is saved can be reinvested in the NHS.
Well, that was Simon Burns in 2012, talking about what he thought would be the benefits. Let's talk now to Sharon Brennan from the Health Service Journal. Sharon, what did the Lansley, they were Andrew Lansley reforms, he was the Health Secretary at the time, what did the Lansley reforms do to the NHS?
On a very broad level, they created a reorganisation at a local level, which meant that there was originally these boards called strategic health authorities, and they turned them into clinical commissioning groups. But the idea of that was that GPs would learn to commission for their own population so that the people they were treating would get the care they needed. That was largely seen as quite disastrous. And then on a national level, they effectively tried to depoliticise the NHS by creating NHS England and giving the power to NHS England to which is an answer body, to control how the NHS was being run and to kind of create their own strategies. So it was quite a step change in the sense that the Department of Health would no longer have direct control over the NHS.
Right, so Sharon, why are they now being stripped away?
Well, two reasons. I think the Lansley reforms were not welcome when they were introduced, and they haven't worked. Although we've had like an internal market and working in the NHS for quite a while, the Lansley reforms introduced a commissioner-provider split, which for your listeners is basically there was a gap between the people who were buying your care and the people who were therefore then offering the care. That has been really hard to manage. It's created a lot of bureaucracy, a lot of admin time, and basically is seen as kind of going against the grain of the NHS, which really is about collaboration and helping people, helping trust to care for patients rather than compete for patients. So that's changing, and I think that's very welcome within the system. The other thing that's changing is that it looks very much like the Department of Health wants its power back. And, you know, in short, I think it's changing because there was frustration with how Simon Stevens, who's led NHS England, kind of used his power to get what he needed in terms of finances, staff, and kind of control over the national agenda. And I think ministers have had enough of that.
Right. I mean, talking about it, of course, as we are, to some extent, in the abstract, what difference would the public have actually noticed when using health services under the Lansley reforms?
What they were meant to notice was that if you didn't like care in your local hospital, the idea was, as Lansley said at the time, was you could vote with your feet and go elsewhere. Obviously, that doesn't work for people who are busy parents or less economically able to travel for care. So what they probably would have found was that some areas gave very good care and some areas gave very bad care. In terms of the change now, the point is to hopefully integrate your care better, which for the person listening means your GP should know what's happening to you in your secondary care, which is like a hospital, and your secondary care should know what's happening in your GP. So hopefully your experience as a patient will be a lot easier. Whether that happens or not is kind of time to tell, really.
Right, so has it, in your mind, turned out to be a pointless reorganisation, the very thing that David Cameron said he wanted to avoid at the time?
Largely, it has been pointless. It created a lot of distraction for about 3 years when really the NHS should have focused on getting its waiting list down and managing its finances better. Two things I think that were good. I do believe that NHS England having that independence to set its own strategy and to try and get away from political rows over what the department should and shouldn't be doing, that was welcomed. And I would be, I'd be interested to hear NHS England's response, but I can't imagine Sir Simon Stevens is happy with proposals as they stay. I think the other thing that's interesting was previously, it was very much like the previous organisation was marking its own homework. And there was an attempt in the Lansley organisation to make sure that the money that was being spent was good quality and taxpayers were getting best value for money. And I think the current legislation doesn't include that element.
Okay.
So there are two issues there that I think were beneficial over what was ultimately a disastrous reform.
Right. Well, thank you very much. On that last point, Damien, a disastrous reform. When I think back to the time and energy that was expended politically and practically, do you now think it was a pointless reorganisation that was carried out by the Conservative-led government?
No, I don't think it was a pointless reorganisation. I look at what's happened in my own constituency area. I think we've seen with the local clinical commissioning groups more GP leadership in delivery of services. I think the establishment of NHS England was a good reform as well. But I think looking where we are now, nearly a decade on, I think and in response to a pandemic, which I think has stress tested the whole system, I think we can see that we need better integration between primary and secondary care, between the GPs and the hospitals, and integration with social care as well. And I think in terms of the role of ministers, and whilst we have to wait to see what the government proposals are, whilst it's good that NHS England has independence to plan for the future, we also can see that the expectation is that ministers will also be able to make sure that the right outcomes are delivered, as we've seen through the pandemic.
Damien, we seem to be having some interference. We seem to be having some interference. I can hear another voice on the line, wherever that's coming from. I'm just going to pause you there while we go to Gabby to answer. Gabby, just to remind viewers, of course, these were reforms that were carried out the NHS in England. But do you think it was pointless at the time?
I think even at the time there were some regrets. I mean, it was seen in Number 10 as this sort of very technical thing that Andrew Lansley was obsessed with and no one else was that interested in, so let him get on and do it. And then I think only halfway through, when it became quite politically toxic, Number 10 woke up and thought, hang on, what do we sort of let loose here? And there was always a degree of ambivalence about it and about the sort of the sheer sort of the amount of negative publicity it created and also the amount of upheaval it created in the NHS. Was it really worth it, what it delivered? So, good to see government, coming back on that and having learned some of the lessons of the past year, which has been the NHS works best when it's collaborative. All bits of the NHS have pulled together and worked together. Even at micro level during this crisis, you've seen consultants pitching up in ICU doing shifts as healthcare assistants because their bit of the hospital isn't busy, So that sort of sense that the NHS has that we all pull together in the crisis. It's good to see the government responding to that by moving towards a more collaborative, less competitive model. I can't like to see what happens to public health under this reorganisation, because of course what Lansley did was hive it away from the main NHS and park its budget with local government, where it's been unfortunately subject to cutbacks over the last few years. So it'll be interesting to see where that ends up. It's an awkward time now, though, to do a big reorganisation, because obviously the NHS quite busy with a pandemic, and to try and start sort of reorganising the debt chairs in the middle of that is obviously going to be quite difficult.
Annabelle?
Sure, well, I agree with Gabby that the timing is certainly extraordinary, but my concern is also with the narrative. I mean, it seems quite strange to suggest that things have gone wrong because the government didn't have control of the NHS this time, but we have one of the most centralised healthcare systems in the world. So ultimately, the government is saying that things went wrong with government in control, and the solution is more government control.
Right. Well, Claire, what do you think about that as an issue? I mean, is it a good thing to have a monolithic, centralised NHS?
Well, it's worth saying that these reforms didn't really apply here, and that's not to say that the health service here is in any way perfect, but they do seem to have been wrong-headed. I wasn't around at the time, but my assessment from reading about it was pretty much as Gabby Hinsliff has outlined there, that they seem to introduce the worst aspects of marketisation and the worst aspects of bureaucracy and mainstream them. And if there were moves to come back from that, I think it would be very welcome. But I think the proposals and the floating of having more ministerial and political control are very concerning. And I say this with the appropriate amount of respect. I don't have great faith in the bona fides of this government as regards to the NHS and management of the NHS. And I think that will give concern, to say nothing of the fact that the service is in the fight of its life at the moment on COVID and probably doesn't have the bandwidth to be, doing a lot of administrative reform. I mean, isn't this in the wrong time, Damien?
Well, I say, look, we're based on a story which is not based on a government statement or a proposed set of measures, but on reporting. But I think it would be extraordinary if post-COVID we didn't say, well, let's look at how we responded to a pandemic, and if we had to deal with that challenge in the future, what lessons would be learned, and are there structural lessons for the way the health service works as well? I mean, let's be clear, the health service has done an incredible job coping with the demands that have been placed on it by by a pandemic and making sure that people are getting the treatments that they need. I think what's also demonstrated as well is that actually it isn't monolithic. It's a series of organisations that work together that are managed differently. And we want to improve the way they talk to each other and they communicate with each other, the way they share data with each other, the way they manage patients' needs through the different aspects of the service that's provided through hospitals, GPs, and social care and community care as well. So I think it's right that we should be constantly challenging ourselves to say, do we think we can improve on this?
Right, but managed differently through other parts of the UK, Claire, as you were saying too. What do you think we should learn then from the pandemic in terms of any changes to the NHS?
Well, I suppose at the very top line is the value of it and the fact that, even though it had been left in a perilous state, it was what kept all of us, I suppose, and society from collapse. So I suppose we try and garner that sense of buy-in and support and I suppose value that people are now seeing and placing properly on the National Health Service. And I think we should translate that over into the longer term conversation about funding. And I welcome separate proposals around, for example, windfall taxes on those who have done very well out of the pandemic. I proposed similar to the Chancellor last year. So I think we bank the newfound interest in protecting the NHS from across the political spectrum, and we talk very seriously about how to give it the best possible governance opportunities and certainly give it the funding it needs in the long term.
Right, but Annabelle, has the vaccination rollout, the success of it in terms of the numbers of people that have been vaccinated by the NHS, point to a more centralised way of running health services in England as being better?
Well, certainly the vaccination rollout has been a great success for the country and for the NHS, but fundamentally what we need is root and branch reform of the healthcare service. Now, over the course of 2020, NHS had net approval ratings of between 80 and 88%. And what worries me is that while this was, I imagine, mostly about the heroic efforts of doctors and nurses on the front line, it's going to make reform of the NHS extremely difficult. We need to remember that these workers are trapped in a failed system, and that ultimately we did have one of the worst excess death tolls over the course of 2020 and as a result of this pandemic.
It's not a failure of the NHS though, that death toll. I don't know that that's a failure of the way the NHS operated. It might be the failure of the way government operated through this crisis. I don't think it's a mark of failings in the NHS.
Annabelle?
I'm so sorry, I didn't quite catch that.
Oh, well, Gabby, repeat it.
Sound issue.
Sorry, I hope everyone heard that. But no, I wouldn't say it was a result of failings in the NHS that we had one of the highest death tolls in the world. Failings of governance, maybe failures of policy, but I'm not sure what failures within the NHS you identify there as contributing to the high death toll.
Annabelle?
Well, I think it's very difficult to really learn any lessons from this pandemic, but it seems that one of the conventional wisdoms is that the NHS and any missteps there might have been is now beyond reproach. But if you look at some of the countries that have performed best on the key indicators, particularly in terms of healthcare outcomes, they're the Asian tigers, and they have healthcare systems that are nothing like the one that we have here in the UK.
Their healthcare systems. That's not to do with their healthcare systems, surely. That's to do with their success in test and trace. That's to do with the speed in some cases with which they close their borders. That's to do with previous experience with SARS and MERS. I don't know that it's to do with the quality of the healthcare provided. The issues that we've been looking at in this country are, could we get test and trace off the ground? Did we lock down too late? Did we unlock too early? Those are policy decisions that are taken at the top. And of course, there may be some issues there about how the NHS and government communicate to each other or how government and scientists communicate with each other. But I don't think that we're looking at necessary failings in hospitals, apart from maybe bed capacity. That might have been an issue.
Annabelle?
Yes, I mean, that's certainly right that we have fewer beds than you see in other countries such as Germany. But you cannot deny that the NHS is a collapsing, buckling system that needs fundamental reform. And were we able to reform it, then perhaps we'd have healthcare outcomes more similar to other developed nations, unlike ones that are more similar to what you get in nations like the Czech Republic and Slovenia.
Right, well, Damien,
I'm not sure that collapsing and buckling is the opinion most people have after the amazing year the NHS has proceeded, to be honest.
Right, well,
we all collapse and buckle so badly.
No, well, do you see it as a buckling service, Damien, in the way Annabelle has described it, and that in fact it's the fault of the NHS system rather than politicians' decisions that have resulted in poor outcomes and a high death toll?
No, I don't see it as a buckling system, and I think actually I find that that description quite offensive, given the extraordinary efforts the NHS has made over the last year to serve the needs of the nation through COVID. And we've not seen what we've seen in some other European countries of people not being able to be admitted to hospital for treatment because there weren't the facilities to treat them. I think with the increased capacity with the Nightingale hospitals, with the fact the NHS is leading a world-leading rollout of the vaccination programme, I think these are all things that we should be very proud of. But of course, I think what the pandemic has done is stress tested the whole system. And I think there are things that can be improved in terms of the way data is shared between different aspects of the NHS to improve the delivery of services. And I think there is a big public health question as well about saying, do we need to be fitter and healthier as a country? Are there other lessons to be learned when we look back at the impacts of the pandemic?
Okay.
But I think actually one thing we can say is that through national effort, people supported and protected the NHS by adhering to the lockdowns. The NHS had the resources it needed, and it's done an incredible job.
Right. Well, just briefly, Annabelle, you wanted to say something about Nightingale hospitals, I think.
I was just asking Damien how many patients were actually treated at the Nightingale hospitals. And I just reiterate what I said at the outset, which is none of this is to downplay the heroic efforts of the doctors and nurses on the front line. But the issue is that they are trapped in a failed system. In terms of outcomes, quality and efficiency, it's social insurance systems that are consistently ahead of the NHS. I think we all want the same endpoint. We all want people to have access to the best possible healthcare. It's just that systems like the NHS isn't able to provide it.
Right. Yeah.
I think we're on to a very different subject here, but I think the performance of social insurance systems versus the NHS is highly contested. Firstly, in a pandemic, it's been a huge advantage having a universal healthcare system where people aren't frightened of the cost of going to the doctor and aren't worried about whether the insurance is up to date and so on and so on and so on. I think we've got here a case of overlaying an existing agenda for reform on a pandemic. Everyone may have had their own ideas about how to reform the NHS before this pandemic started.
All right.
But that, just sticking to those isn't learning the lessons of what the years taught.
All right, we're going to leave it